Hi, everyone, and welcome. We're gonna start at 1:05 on the dot, just to give people a chance to come in. But we'll talk to you in 2 minutes. Hi, okay, everyone. I think we'll get started. So thank you so much for joining us today for our dive into the latest research on New York State's human services workforce and its wages. My name is Carla Sinclair. I'm the Senior Associate at the Senior Communications Associate at the CUNY Institute for State Local Governance. I'm going to kick us off today by giving us a quick walkthrough of the agenda and provide some light housekeeping notes before turning it over to my brilliant colleagues. So first, we're going to hear from the Bring Up Minimum Pay, or BUMP campaign, which funded the study, and then they'll turn it over to CUNY ISLG researchers who conducted the analysis. And so while they're presenting, please feel free to put any questions in the chat, and we'll do a Q&A session at the end of the presentation. All right, I think with that, I'll turn it over to BUMP. Are we having some, sorry, go ahead.
Thanks, Carla. I think we're going to start by hearing from Michelle Yancey. She is Executive Director over at Good Shepherd Services, who's going to talk to us a little bit about BUMP, and then we'll turn it over to Keith Little.
Hey everyone, can you hear me? I'm so sorry. I don't know if I'm having technical difficulties.
Yep, we can hear you.
There you go. There you are. Sorry, that was my little computer problem on my end. Hi everyone. It's so nice to be with you. Thank you for joining. I just wanted to start off with a quick overview of why we are here and why BUMP exists and why this work is important to us. Starting with really the problem that we are seeking to address. I don't think this is going to be news or a surprise to anyone in the room, but we have a significant footprint in the workforce of our state. Right now in New York, 1 in 9 workers is a member of the human service sector. And these are overwhelmingly folks who work on the front lines, people who are caring for our friends and neighbors, our children, supporting those in crisis, and really there to work every day to hold up our communities across the city and the state. But unfortunately, many of them earn so little that they also qualify for the same services that they work to provide. And my own organization, I'm the executive director of Good Shepherd Services, which is a one of the larger children, youth, and family serving nonprofit organizations where we are located in New York City. And our work is overwhelmingly done in partnership with our city and state colleagues through government contracts for human services. So the vast majority of our staff are really carrying out work supporting our neighbors throughout the communities of New York City, and really doing the work that we are contracted to do through these partnerships with our government partners. And the one of the challenges for us in really trying to move the needle internally here at Good Shepherd Services to move towards salary equity, to really try and ensure that we are providing wages and salaries that can help support our staff, our colleagues, to be able to provide for their own families, is the fact that most of our money in our budget is coming through these government contracts, and the contracts themselves drive wages, wage levels through the model budgets and the rates and the overall parameters of the government contracts. And so over these past few years, we've really worked to try and raise wages, especially at the front line for our colleagues who are making the lowest wages. And while we've been able to make a small amount of progress internally, most of all, we learned the limitations of what we can do as an individual organization without the real partnership of our government partners. Because, for example, if someone is making a wage that's in the 30s or 40,000s, across the board COLA, for example, does not really move the needle significantly for them. If someone is making $40,000, for example, which is one of our lowest salaries here at Good Shepherd Services, even a 3% COLA will still have them making about 41. And so that really is primarily why this was work that was important to us, was really to elevate the fact that to make a difference for staff who are making the lowest wages, we need to address their base salaries so that ultimately any COLA implementation that happens is applied to a base that does reflect the true cost of living, and then can have the real impact that we want it to have. And so this for us is really about addressing the root cause, and that is base salaries that don't reflect the true cost of living, and the government contracts that really are driving those base salaries. And without addressing the government contracts, there's very little that we can do to make a true impact. As the data will show that you'll hear about, wages have remained flat for these workers in our sector for years, while the private sector pay, for example, has grown by over 12%. This just really is not fair, and it's a structural problem that keeps our essential workforce and our colleagues who are basically doing the cities and the state's work to fight poverty. It's keeping them in poverty at the same time. So we created the BUMP campaign, which stands for Bring Up Minimum Pay, and it really is about addressing that base salary issue. This is a single issue anti-poverty campaign And the campaign is entirely about fighting to set a legal wage floor that would be the floor under which a government contract cannot allow a salary for a staff person who is working under that contract to be paid less than. And this is a legal wage floor for the nonprofit human services workers, and one that is aligned with the true cost of living. I'll end there and I will pass it over to my colleague Keith.
Great. Thanks, Michelle. Much appreciated. For those of you who don't know me, my name is Keith Little. I am an executive leader, or have been an executive leader for 3 nonprofit organizations. And currently I am a consultant in the nonprofit sector. So I guess you would imagine that I'm a key stakeholder in this critical issue. As Michelle was saying, that the BUMP campaign is critical in terms of addressing and focusing on the legal wage floor and how we escalate the legal wage floor. I think in terms of the BUMP campaign, there are 2 major components to the campaign. One is in partnership with CUNY, Institute for State and Local Governance. How do we identify data that really crystallizes what the problem is, who's targeted, what the issues are as it relates to living at the poverty level and having wages not be adequate? And then the second part is, how do we use legislation to push this agenda? So CUNY has done a great job, and I know they'll be presenting information later in this presentation about what does the data tell us. I think the good part is that we have an announcement that the legislative solution in terms of legislation, we have in the coming weeks, Senator Comrie and Assembly Member Reyes will introduce legislation to make this wage floor the law. And we feel making it the law will help be able to emphasize and really show the impacts of COLAs. So if you have a wage floor and you have a COLA, we think that is part of the combined solution. We're not looking at this as a pilot. We're not looking at this as a promise. It's a mandate that no child care worker in New York should live in the poverty or below the poverty level. And so I think we're really concerned about that. I think the bottom line is what we're looking for is in terms of a call to action by all of the key stakeholders. And we're asking everyone and anyone. We're talking about lawmakers, we're talking about the press and the media, and we're talking about the public to join us in this campaign so that we can move this agenda forward and have this legislation enacted. We're aware of what the problem is. We know what the solution should be. We're asking that let us bring the minimum pay and give human services workers the dignity that they truly deserve. And with that, I am going to pass it on to Stephanie.
Thanks, Keith. Actually, I'll kick it over to Allison and I'll advance the screen.
Great, thanks, Stephanie. So to kick us off, we wanted to just take a moment and explain who we are. So the CUNY Institute for State and Local Governance, we're a good governance think and do tank. So what does that mean? We partner with government, with the public sector, the nonprofit sector, and community leadership from the grassroots to the grass tops to work together to improve systems that the very systems that touch our lives every day. And we use a number of different approaches across these different systems and sectors, and grounded in our really diverse team coming from a lot of different personal and professional backgrounds to kind of help us meet the needs of the project that we're working on. And on the next slide, we'll speak a little bit more specifically around our work in this sector and what brings us here today. So, you know, within our work in the human services sector and specifically within the workforce, we of course have done a number of research projects and studies in understanding the experiences and barriers within the field. We also work with nonprofits and government around program evaluation. We have been citywide and statewide training and technical assistance providers for nonprofits, doing both kind of on the ground programming, TA, and training to working with senior management and executive leadership around program operations across New York State and trying to, work more directly within the human services field. And we also partner closely, of course, with government across the country and nonprofits and leaderships in advising, developing programs, demonstration projects, and so on. And it's from this knowledge, both for some of us, our histories as practitioners, as well as our work at ISLG, that kind of came today in the study that we're going to speak a little bit more about now as I pass the mic on.
Thanks so much, Allison. So we're finally getting to the research findings we've been alluded to. So like has been said, ISLG was engaged by the BUMP campaign to look at the human services workforce and try to use publicly available data to understand wages, how those wages have matched or not matched cost of living, and then try to get at some nuance within that. And so we recently put out a report, and we're excited to share those findings with you. So as has been stated, and I'll go through this quickly, the human services sector is extremely critical to the state, to our economy, to our well-being, childcare workers, home health aides, nursing assistants, social workers. There are many professions, helping professions in this sector that contribute to our economy and quality of life. And what we have found in our research, again, not particularly surprising perhaps, is that wages for these very important occupations lag what is the cost of living, an expensive state to live in, and we just don't see wages keeping up. And so some of this has been stated already, but I'll give a quick overview of our top line findings and then we'll get into the details. We estimate that human service workers on average are earning about $20,000 a year less than the cost of living. So that's quite significant, and that's the gap we'll explore more. This industry has a large footprint in New York State. 1 in 9 employees, Michelle cited that stat earlier, are in this industry. The industry is made up mostly of female immigrant women of color. And though closing the gap for wages and cost of living is really expensive, obviously that is necessary, and really that gap represents how the industry has been underpaid over years. And so now we'll turn it over to Cecilia and Brian to kind of dig into the specifics.
Great, thanks, Stephanie. Hi, everyone. I am Cecilia Low-Weiner. I'm a senior research associate at CUNY Institute for State and Local Governance. I'm going to start out by talking a little bit about how human service wages compare to the cost of living. So when we look at the cost of living, we say that in New York City for a single adult, the cost of living is around $58,000 a year. If you add a child into that situation, the cost goes up to around $100,000. If we sort of zoom out and look at New York State overall, we see that for a single adult, the cost of living is around $35,000 a year, and an adult with a child is $66,000. We know that most human service workers earn below the cost of living, especially those with children. So if we look at the household types for families that have a human service worker, when we look at one adult households or single adult households with a human service worker, 57% of those households earn below the cost of living. If you look at a one adult, one child household where the one adult is human service worker, that goes up to 85% are earning less than the cost of living. Now we can look sort of across the state. We know that human service workers throughout the state earn less than the cost of living. Upstate New York, relatively is more affordable than New York City area, but there is still a gap between the wages and the cost of living. If you take a look at the map to the right, the sort of darker the purple, the higher the concentration of single adult households that are living below the cost of living. So here you see sort of highest concentration in New York City, also in Westchester, Long Island, up in Utica, Rome, and Albany, Schenectady, Troy area. And then there's sort of lower end of the spectrum, lower concentration in Ithaca and Glen Falls. I'm gonna pass it on to my colleague, Brian.
Hello, everyone. I'm Brian Holliday. I'm a senior research, not senior. I'm a senior data scientist at CUNY ISLG, and I'll talk a little bit about the trends across the human services industries at large. So, as was stated before, yeah, 1 in 9 workers in New York State is a human service worker. This equates to about nearly 1 million workers across New York State being a human service worker as of 2023. And if we look at trends over time, uh, the number of human service workers has went up significantly over time in New York State, whereas in the year 2000, about 7% of workers in the state were human service workers. And as of 2023, about 12% of workers in New York State are human service workers, meaning that the industry has nearly doubled over that time period. So, yeah, private employment across New York State has grown about 14% since 2000. But if we look at employment across the human services related industries, employment has grown by about 89%, with home healthcare services being the most significant contributor to the growth at nearly over 400% over that time period. But there's other significant ones like services for the elderly and disabled and childcare services. So despite the growth in the human services related industries at large, wages for human service workers have remained stagnant over the past 2 decades. For private employment, real wages have grown by 12%, but in human services related industries, wages have only grown by 3%. And so, if we look at if we drill down into some of like the specific industries that fall within human services, we can see that some of them have grown, but a more concerning trend is since 2022 in a high inflationary period, wages have gone down significantly across industries for human services workers, with home healthcare services workers, real wages going down by 10%. And to talk about some of the more specifics of human service workers, I'll pass it on to Cecilia again.
Thanks, Brian. So yeah, I'm going to talk a little bit about sort of who this workforce is. So the most common occupations, which are childcare workers, home health aides, and nursing assistants, earn the lowest wages. So those 3 occupations actually make up 80% of human services related occupations, and they make the lowest wages. If we look at childcare workers and home health aides, they make the lowest at around $38,000 a year. We also know that wage growth is limited. So even for experienced and skilled workers, the wage potential in these positions and these occupations is very limited. So the gap between entry level and experienced wages for home health aides and childcare workers is about $10,000. For nursing assistants, it's a little bit wider, but you can see even the highest 10% wage is below the cost of living for a single adult. And then we know that women of color, many of whom are immigrants, make up the vast majority of the human services workforce. So home health aides, nursing assistants, and childcare workers, again, those 3 occupations that make up the majority of the sector, have the lowest wages and as a result, higher rates of poverty and public benefit utilization than other individuals across New York. If we look at the chart below, we see that 84% of these workers are people of color, 91% are female, and 70% are foreign born. And then in terms of economic characteristics, which are measured for households with a human services worker, 15% are below the poverty line, 34% live in households that receive SNAP benefits, and 7% have no health insurance. This is also disproportionate. So compared to the New York population overall, it's around 23% of New Yorkers are foreign born. We see here that it's around 70% for human service workers. And then similarly, while 16% of New Yorkers live in a household that receives SNAP benefits, we see that for these human service workers, this is disproportionate. We have it at around 34% of human service workers. I'm going to pass it back to Stephanie.
Great, thank you, Cecilia and Brian. So I just have a few more slides to kind of close out the research presentation, and then we can open it up if there are any questions. So like was mentioned at the top, a portion of our analysis is looking at closing that gap between the cost of living and wages. And so we estimate this to be about $20,000. It's a kind of complicated estimate in the sense that there are different measures of cost of living. There are different ways of thinking about or estimating how much wages an individual earns working full-time over the course of a year. Many workers don't work full-time, for example. But when we kind of look at this broadly and we're trying to ballpark what that gap is, we come to about $20,000. And so the bottom line, when we take that gap and we multiply it by, the workers across the state, we're talking about, billions of dollars in wages that are essentially underpaid. So this is expensive to, bring up the wages to close that gap. But again, we think about that as potentially thinking about that as like the underpayment. Essentially, that's been going on in the industry. And so in terms of next steps for our research, so we have our report out. You can find that on our website. I think it's linked in the invite. We are continuing on to some other aspects, of thinking about this gap. If we were to make up those wages, if we were to increase wages, there are obviously a lot of benefits to doing so despite the price tag. And so we are estimating, what is the return to government when wages go up? Returns can be seen in the form of reduced reliance on benefits like SNAP. It can be seen through increased sales tax and income tax. So there are ways that increased wages, go on to increase some revenue. There are also returns to the community. So what happens when you've got people in a community kind of earning a higher wage? How does that affect local businesses? How does that affect that local economy? And then of course there's a huge return to individuals that we will also be quantifying in the next analysis. So we're excited to move on to that phase. But while we're here, we're looking forward to your feedback, questions. We've got representatives from CUNY ISLG to talk about the research side. And then the campaign folks are also on the line to answer questions about the campaign as needed. So with that, I'll stop sharing my screen and we'll open it up to questions. And Carla, I think you're reading out the questions.
Hi, yeah. Thank you all for that wonderful presentation. So we do have one question here. Did you consider how the average level of education across the different levels of employees in this field impacts the wages? For example, from my understanding, home health aides generally require a high school diploma or GED and a certificate rather than a college degree, which may contribute to the overall salary for this group.
So we just did a small analysis looking at the education levels, and we do see, we haven't published that yet, we do see, Cecilia and Brian, correct me if I'm getting this wrong, a pretty high level of high school or GED percentage of workers in the home health aid space specifically. I think though that the larger point of this research is that even with a lower educational attainment, the wages are still below the cost of living. And so that's the kind of element we were trying to tease out. We do, and it was featured in some of the slides, feature other human services occupations, which include social workers and other positions that typically require an advanced degree. And we do see higher salaries for those jobs.
Great, thanks. Our second question here is, can you say a little more about how you estimated cost of living? I know there are a lot of potential ways of doing that.
I can start out, and then Stephanie, you can also jump in. So yeah, there are a lot of different methodologies to estimate cost of living. We explored in our report 3 primary ones. It's the self-sufficiency standard, which comes out of the University of Washington, the MIT living wage calculator, and I'm blanking for a second on the third one. Stephanie.
It's not a standard, but we use 400% of the poverty threshold, which is often used as a gauge.
Yep. And just so folks know, for these slides that you saw today, we're using the self-sufficiency standard.
Great. Okay, we're getting a couple more in here. With all this data showing a clear gap in pay, what solutions can we take to address this problem head on?
Well, I might turn that over to the bump campaign. And I see that the next question is getting involved with bumps. Maybe that can be addressed together.
Yeah, thank you. Most of all, I think we need to elevate this information. I don't think that there is a really clear understanding of how serious the wage underpayment and really like poverty level wages that frontline staff, especially in the human services, are making. I think that there's been a lot of attention about, sort of the need to raise wages, but I don't think that by and large, folks really understand how low some of the salaries are, how large the gap is, and also, what it would really take to make an impact. And so, most of all, it was always our desire to have data to make that case. That's really part of what was behind wanting to do this work, and to make this data widely available for everyone to use. Our hope is that whether or not someone wants to get involved with the bump campaign, that you can use this data to inform your own efforts and to make sure to elevate the information so that at the very least we can have a fact-based conversation about what the problem is, and also what some possible solutions are and what's to be gained from that. I think especially the information about return on investment is going to be very important to show how much the state and all of us have to benefit from it. And if you'd like to get involved with BUMP specifically, please reach out to us. Please sign up to get our information and join your efforts to ours. And most of all, please use this data to inform your own efforts to educate legislators and within your own organizations, with your own boards.
Yeah, let me just chime in for a minute. I think Michelle was spot on. I think the other part is to understand there is a link between poverty level wages for our frontline employees and our ability to provide quality services in the human services sector. Um, um, Plus, being able to recruit and retain quality staff. That's been a major challenge for all organizations. Some of it's attributed to the pandemic, but it continues to persist in a lot of different organizations. So being able to understand that there is a link between the workforce and the services we provide is real critical. And that's why this is so important also.
And I'm seeing a question in here about where we can access the report. I'll drop a link in the chat, and I'll also follow up this webinar with a link to both the slides and the report. But for our next question, I know that recruitment and retention has been a persistent, challenging problem for childcare and early education. Are other human service fields facing this issue? And is there a way to demonstrate that a wage floor or bump could help recruit more people into these crucial fields?
Short answer is yes. I mean, Good Shepherd Services, for example, we are not a childcare and early education provider. And we are experiencing significant challenges across multiple program areas, and it is entirely connected to the level of wages that those jobs are able to offer. And so it definitely is a sector-wide issue. And I can speak personally. I know that we have staff even who want to continue in the work, but just cannot afford to for their own to support their own families, who end up leaving the work to work in retail or Target or DoorDash. I mean, that is that is there's a direct correlation to the issue of wages.
And I'll also just add that that's something that we plan on exploring in this next phase that Stephanie brought up, is looking at the impact of higher wages on retention and recruitment efforts.
Great, thank you. Another question here. Did you compare human service worker salaries from nonprofits versus government employees doing similar work? For example, those working for Department of Social Services compared to their nonprofit counterparts, do you anticipate low government employee wages being a barrier to ask that nonprofit folks be paid higher contractually?
I can, oh, go ahead, Cecilia, you go.
I was just going to say, yeah, so a couple of sort of nittier grittier things, which I think we speak to a little bit more in the report. Different public data sources have sort of different levels of information. For the industry data, we can look at the private versus government wages. For the occupation, we can't. So we have looked at looking at government wages versus private, and actually sort of on average, we said government wages are higher than the private sector wages in these. But yes, again, so, and we can provide more detail as well, but different public data sources have different levels. So here in this presentation, we were looking at private employment, but yes, we have looked at that versus government, and the government on average has higher wages.
There's also been some work out of the New School on this too, looking at wages in New York City and comparing government employees versus contract employees, and we do see that. But I think the question is kind of like it's a policy question, or maybe maybe I can bump this to the campaign question of, what happens if now contract wages rise above government wages. I think the gap is pretty wide, and I don't think, frankly, we'd be at risk of doing that. But possibly, when wages go up for a sector, it will have upward pressure across the board.
I mean, we would have to make substantial progress for that to really be a problem. I think all of us would welcome having that as a challenge to deal with. But I can say that, I think that on principle, we believe that no one should be paid a wage that is not at least at the level of the true cost of living. And so that applies to folks in every sector. It really, though, is very much the case, as this data reinforces, that it is the staff in our sector who nearly uniquely have that challenge.
I can also add a little bit to this. Good afternoon, everyone. Yolanda McBride, Senior Vice President of External Affairs and Public Policy at the New York Foundling. And at the Foundling, we have almost 2,500 employees, and about 1,100 of those are actually DSPs, or direct service providers who are working in the working with our intellectual development and disability community that we serve at the Foundling. And that is an industry where the hourly rate is much lower than the government rate. So we're talking about almost I think it's about almost a $10 to $12 difference. And so that is a huge barrier for us as an organization to Keith's point about maintaining and recruiting employees. And so a lot of our DSPs actually hold 2 or 3 positions. And so they are working for the Foundling, and they could be working for Good Shepherd, and they could be working for another organization to kind of piece together a salary that will allow them to address the the needs that they have for their family. And so, yes, that is happening in the DD space, development to disability space, and I also know that it's also a challenge in the childcare spaces, as it was mentioned. We do provide childcare, but not in New York State. We do provide childcare in Puerto Rico.
Great, thank you. Another question here. Do you envision as part of this research to have data that is titles/job function specific?
Yes. Well, so our research includes a breakdown of different human services industries and then human services occupations. We get into the kind of difference in the report. But what's nice about the online report is you can, they're interactive graphs. You can kind of hover over and get specific data points for specific industries or specific occupations. Like Cecilia said, we're using publicly available data, so we're sort of bound to the definitions and categories that exist in those data. But again, it still gives a pretty fine tune.
Yeah, I was just to add to that, in the report also, there is a link, I believe, to an appendix which lays out all of the different industries and occupations. And so those are the ones that we have used to create our sort of overall human services as well. So when we're talking about the average human services, we're compiling those occupations or those industries depending on the graph.
And there's a related question here. That is, you mentioned that you were working with publicly available data. Can you share the time frame of that data? How might COVID impact the data on salaries?
I believe the data goes back, Brian, correct me if I'm wrong, to it's 2023. We look at 2000 to 2023, or about that. Again, a little bit variation in the data sources. With COVID, we saw, and we had some graphs to this effect, real wages declined, meaning that inflation, I would say in the post-COVID period, real wages declined. So inflation essentially outpaced wages. We see that kind of across the board, as I'm sure everyone knows, but particularly that has a particular effect on the lowest paid workers.
Great, thank you. And we have a couple related to the legislation, so I'm going to kind of combine a couple here. One is, can we hear more about the proposed bill to make wage floor the law? And is it possible to share more about the timing of the legislation release, the legislative ask, and what policy, advocacy, or lobbying efforts you think will be needed to push this effort forward, especially during what will likely be budget crunches on the federal, state, and city level?
Yolanda's coming on to answer.
I didn't know if you wanted to start, Michelle.
No, go ahead, you go.
Okay, so I will turn to the timing of the legislation. We are hopeful that the legislation will be released this week. And if not this week, then before the end of this month. And so we're hopeful. We know there's a little bit of a backlog, but we are very hopeful. Let's see, I'm just trying to make sure I answer all the parts of the question. So in terms of policy advocacy efforts to kind of push this effort forward, I do believe that members have an understanding of a basic understanding of what the challenges are. So the data is super important to help understand what's happening across the state in terms of county specific. How are human services workers kind of what their challenges are based on the sectors in terms of salaries. And so one of the things that we do plan to do are to have kind of like these educational sessions and forums across the state and various regions and counties to kind of really highlight what those specific challenges are. The data is telling us one thing. We have profiles on the counties, but learning more in terms of working with providers about what's happening and them talking to legislators about how this is actually playing out in particular communities is critical to those advocacy efforts. So we're doing some traditional lobbying, like having lobbying days, meeting with legislators, but we're also doing regional conversations across the state in areas, in specific areas. And yes, in terms of what's happening in terms of the federal budget and the impact, we're monitoring it because we don't know how all of this will, how what's happening at the federal level will impact the state and the city. And there's some sectors where the fallout and the impact might be larger, but we're monitoring it. So it's hard to say right now what that will look like, but that's the nature of campaigns and campaign work, flexibility and working through those changes as they come.
Great, thank you. So when do you expect to have the return on investment research available?
We've started work and hopefully we'll have something to share publicly late summer, fall.
And we just got a question related to the legislation that I want to go back to, but who are the bill sponsors?
The bill sponsors are Senator Connery and Assemblywoman Reyes.
Great, thank you. Here's another one. Appreciate and agree that the scale of wage gaps might not be fully understood, but my sense is that state leaders and legislators know that we are billions short in the aggregate, and wondering if part of this is developing novel approaches and proposals to help find money or shift money into these contracts to get to big issues being outlined.
Can you repeat the question? I didn't quite follow.
Yeah, sure. Appreciate and agree that the scale of wage gaps might not be fully understood, but my sense is that state leaders and legislators know that we are billions short in the aggregate. And I'm wondering if part of this is developing novel approaches and proposals to help find the money or shift money into these contracts to get to the issues being outlined.
I mean, look, we should always be in search of novel approaches, and especially related to revenue strategies. There's, this is going because of the length of time and the severity, and with each passing year, the gap gets wider, and the amount of resources needed to address the problem is greater. And so we're going to need to come at this from multiple directions and multiple strategies. And my hope is that both sort of really fully understanding, how low these wages are for staff who themselves are doing the states and government's work, and the return on investment, to really understand that investments to address this issue come back to the state in many positive ways, including directly through increased tax revenues, will inspire our state leaders to find the resources and to prioritize. So I think it's multiple strategies: creating political pressure and understanding that supports prioritization of the workforce, really understanding that the amount that will be needed to address the issue directly can be discounted, so to speak, by the amount that comes back to the state, and then also maybe we can identify novel approaches to identify revenue streams to be shifted into our into our contracts.
Great, thank you. Just a few more here. So how do you factor in differences in benefits? Healthcare, just for one, can vary widely between agencies and costs to the employee and what employees receive.
That's a really good question. Maybe I'll give a little bit, and then Brian, Cecilia, and Allison, if you guys have other things you want to add. So One is the cost of living includes, estimated costs for healthcare. So in turn, built into like what we think that floor is for cost of living across the different ways of measuring that, healthcare costs are included. But it's a great point that, obviously one of the things that affects someone's bottom line is how much they're spending on healthcare, and that can vary widely. We know some employers have health benefits, some do not. Interestingly, we know that about a third, and again, Brian, correct me if I'm wrong here, a third of the home health aides that are working are on Medicaid. So that would obviously be a really vulnerable group with changes to Medicaid statewide, are potentially sensitive to wage changes. And so it is something that we try to factor kind of broadly in an analysis, and we'll hopefully tease out a little bit more.
Yeah, that's right. And I just wanted to also say, and this is, I think, Carla, also to the next question I see. So I already mentioned the 3 that we used. So sorry, someone asked if sort of where we are getting the 60,000. So we talk about sort of average human service workers making 40,000, although there is a range there. Again, home health aides and such are on average making 38. And that it would be sort of a 20,000 gap to get to 60,000, which is roughly around what the cost of living is based on 3 estimates that we use in the report, which is the 400% poverty threshold, the self-sufficiency standard, and the MIT living wage calculator. I will also say, like, and I think someone mentioned in this question, the Robin Hood's poverty tracker. There is also one out of the Urban Institute in terms of the what the cost of living is, or they call it, I think, something else. But there's a sort of range also in terms of sort of what is the minimum you need to really pay what you need and live in the city or the state. And then there are estimates that go quite a bit higher. That is, some might be thriving, say, cost of living, or thriving, striving. So some of those go up to as much as 150 or so. So there are a lot of different estimates for this we've used, and all 3 of those are roughly around the 60K that we spoke about.
And we certainly welcome others to use the report and the data, especially around wages, to your own kind of needs and uses. So if you have a different cost of living, estimate, or want to kind of contextualize wages in a different way, one of the things we hope is that you can kind of use the many data points that we provide to your own for your own research needs.
So I just wanted to jump back in here because I know there was a question about the legislation, and I don't think I gave the overview that folks were probably wanting to hear a little bit more about the legislation. So I can.
Yolanda, sorry to interrupt you. I think there's a little bit of an echo happening with your audio. Do you know?
Oh, there it is.
Yeah.
Sorry about that. I'm going in closer. Does that help? Is it still an echo?
No, but I think we can hear you.
You can hear me? Okay, all right. So the legislation was drafted. For those who know, there really isn't a definition for human services workers in New York State. And so what we try to do is to craft a definition that is all-encompassing. So the legislation not only talks about non-human services workers in terms of who are funded, licensed, certified, or operated by. We listed as many agencies as we could possibly list. We also not only listed agencies, but we also funding would also be provided to those who are subcontracted and programs that are reimbursed by the state. So as long as the funding is flowing through the state to your organization in terms of for nonprofit services, your organization or that sector would qualify, or that contract would qualify for that. We talked about in terms of the base wages piece. We are looking at 400%. So the base wage or the true cost of living is defined at 400% of the federal poverty level, or $29 an hour, and it's tied to kind of future increases to inflation. So we try to build in a yearly escalator so that we would not have to, so that it would be built in to increase, and also the phase in. It would depend on the area of the state in terms of where their higher cost of living versus lower cost of living. So phasing in based on that. And I think there are other significant pieces. I mean, those are the main pieces in terms of how we structured the legislation. There are other pieces. There are also tweaks, but those are the kind of major key pieces of the legislation. Hope that's helpful. And happy to talk offline for those that want a deeper dive.
We did have one more question about the legislation. What is the name of the bill and where can we read it?
So the legislation has not been introduced yet. As I mentioned, it is being introduced hopefully this week or next week. And so we do not have the bill numbers. But again, the bill sponsors are Senator Comrie and Assemblymember Reyes.
Great, thank you. I don't see any more questions in the chat. We can give folks like a minute more to put anything in, but either ISLG or Bump, is there any kind of last closing arguments, closing statements you want to give?
Thank you to everyone for engaging with us today. So many great questions. We're excited for the next phase of the research, and of course, thank you to our funder, the Bump campaign, for making this happen. And then I think we can give the final word over to Michelle and Keith.
I just want to say thank you to all of you at ISLG for doing this work, and really excited to have the benefit of a data-based case to be made, especially related to the return on investment. I think that's going to be a really key piece in the puzzle, and also to shine the light on what it means for individuals, their families, and communities when we invest in wages. So thank you for your work, and thanks to everyone for joining today.
And I'll just chime in and just echo Michelle's sentiments. Thank you for listening. This is a critical and important issue in our minds. The reality is that the work that the human services sector does is work a lot of times that is thankless, but it's critical work. And good work and good services are the result of good people. And good people need to be paid fairly at a rate where they're going to stay in the system. We know this. We know a lot of our employees, in spite of the wages that they make, they stay with us because they're committed to the work. I think it's time for us to really be able to pay them fairly for the work that they do, because it's difficult work, whatever sector you're talking about in human services. So thanks for listening, and hopefully you'll be able to be an advocate and move this issue forward.
And just popping in to say, if you are interested in following along for updates about the legislation or about the Bump campaign, I think the best way to do that, if you don't have a contact with anybody who's on this call, is to visit our website, which is bump-ny.com. And there is a sign up to be included on our email list. You can send us an email directly through the site. If you're interested in following that, that's probably the best way to find us.
Great, thank you so much. So this webinar will be available on CUNY ISLG's website, as is the report, and I'll follow up with all these links that we're talking about in an email as soon as this ends. But thanks everyone for joining.
Thank you.
Thank you so much.